When would a patient need a scope scheduled?
So the main reason we're doing endoscopy for anybody anywhere is mostly for colon cancer screening. And so we know that colon cancer is the number 3rd cause of colon or cancers in our society. You know, behind lung cancer and breast cancer, it's colon cancer, so it's very prevalent. And so the main reason that we're doing scopes is to try and screen for colon cancer.
There's 2 different types of scopes. There's a scope for screening, and that typically starts with colonoscopies at the age of 45. And then there's a diagnostic scope, and that's for when a person's having different symptoms like changes in their bowel habits or bleeding or acid reflux.
How often do patients need to have this?
How often do you need to have a scope? Well, you get the screening endoscopy, and then depending on what you find, if it's a normal colonoscopy, they recommend every 10 or 12 years thereafter. If certain polyps are found, then that ups the ante and you would need to come back sooner. Tubular adenomas would probably be every 5 years. Villus adenomas probably every 2 or 3 for sure. And it depends on whether the polyp that is removed has invasive or dysplastic changes, and obviously that would push things up further.
So again, if we're doing screening colonoscopy, it is going to be every 10 years, assuming that they're normal. There are certain instances where we want to do it more frequently. People will have a diagnosis of inflammatory bowel disease, and it's recommended they do it more frequently. A first-degree relative having colon cancer will also increase their rate of the frequency of their procedures.
And what is the difference between an upper and a lower scope?
Well, an upper and a lower, we were joking about that. We always do the lowers first, then we do the uppers with the same scope, yeah. No, an upper endoscopy is done with a shorter scope, smaller caliber or diameter. And we usually are looking for gastroesophageal reflux disease, or GERD, it's oftentimes called, or ulcers, or different types of what we call foregut problems. It can be anything from bleeding to ulcers to reflux problems to whatever.
The upper scope, we're looking at the esophagus, stomach, small intestine, or most of the small intestine. The lower scope, or the colon scope, we're looking at the entirety of the colon.
And what kind of problems or what can you detect during this scope?
During an upper scope, you can see ulcers or changes from acid reflux, and on a colonoscopy, you can find colon polyps or colon cancer, other forms of colitis that can cause symptoms.
We're looking for polyps that potentially can turn into cancer, cancers, diverticuli that can later lead to diverticulitis that can cause problems or hospitalizations, anything in the intestinal tract.
And lastly, why is the new scope equipment needed?
Well, it's like everything other thing, technology is getting better. Technology is better in every aspect, whether it's your new car or whether it's your new phone, the technology is better. And the technology with these endoscopy equipment is profoundly better, and so now we can see more clearly, we can pick up some of these polyps earlier. It's just better technology to make the scope safer as well. I mean, they make them so that they're clearer and they work better. It's just basically, as technology improves, and we want to have the best equipment for our patients.
The new equipment has better visualization, so we're able to see smaller polyps and remove those sooner so that they don't cause any problems. It also has other features on the scope. It has a different stiffness so that you can change that just with a dial, and before we had to use a special tool to do that. So that'll help us with making sure that we can visualize the entire colon and make polyp removal easier as well.